Doctors of Reddit, what is the most unethical thing you have done, or you have heard of a fellow doctor doing involving a patient? My best friend's mother, Rola, is from Lebanon. When Rola was a young girl, she got pretty badly injured and went to the hospital. The doctor then proceeded to tell Rola's mother that she had passed away due to the injuries. She did not believe her and soon discovered Rola locked in a closet, waiting to be presumably sold into slavery. My roommate in dental school was a medical student. There was some big scandal at the hospital he was doing a rotation at because an anesthesiologist left her, or with a nurse anesthetist, and left the patient alone. Something went wrong and the patient passed away on the table. Where were the two of them? Getting down in a nearby unused room thinking that nothing could happen in just a few minutes. It was in the news here, but there was a surgeon in Birmingham, I think, who diathermed, essentially burnt his initials onto patients' livers. My colleague worked with him and saw him do this. I personally haven't seen much that's too bad. There are a lot of pretty dark jokes in the doctor's office, but nothing potentially damaging. A nurse did once offer to give me unprescribed flucloxacillin for a skin infection, but I politely refused. As a specialist who sees a lot of referrals, I see incompetence and laziness, which can be just as devastating, much more than outright unethical behavior. I once knew an OB who didn't like to work after about 5 p.m. So at the end of office hours, if they had someone in labor, they would swing by labor and delivery and find a reason to do a C-section on them. Sometimes they blamed the baby's heart rate tracing, justified or not. But the classic one would be that they would check the patient's cervix and lie about how dilated it was, so it seemed as if labor wasn't progressing rapidly enough, and say, "I just don't think this is going to work. Cut her and be home for dinner." Now in OB we love TLAs, 3-letter acronyms, and one of the real indications for cesarean is CPD, cephalopelvic disproportion, which is where the baby's head is too big for the pelvis. But for this particular doc, we always said that they cut patients for CPD, cesarean, prior to dinner. Edit. No, I didn't report this doc because it's not possible to report someone for a subjective judgment call. As for this doc not being allowed to practice anymore, a hospital can't revoke privileges for being a shitty doc, even if they want to. The law is written in such a way that the hospital would easily be sued for restraint of trade. I don't like it either, but unless laws get changed, that's what we are stuck with. I briefly worked at the front desk clerk for an ER at a local hospital. The rule was anyone that came in complaining of chest pains had to be back and on a machine within 10 minutes of arrival. Once I entered their name into the system, a clock started. So I was told not to enter their name until they had already been taken back to essentially make our numbers look better and make it appear as though they were receiving care within the prescribed 10 minutes. Edit. People complaining of chest pains were typically brought back quickly, just not always within the 10-minute guideline, although generally faster than anyone else. This mostly seemed to be just about producing better stats, although keeping it off the system gave them the ability to delay. There are 3 kind of lies in the world: lies, damned lies, and statistics. Apostrophe. My opinion. Never trust an individual stat. They're almost always manipulated, and if you have chest pains, take aspirin. Dr. John Story of Lovell, Y was convicted for the rape and sexual assault of many young women over the course of 25 years under the guise of pelvic exams. There's a book out about it. I was living in Y at the time, and the weirdest part about the whole thing was the way the town rallied around him and said he was innocent. I think he went right back to that community as soon as he was released. There were some legal shenanigans involved, and I don't remember the actual outcome. Not a doctor, but a male nurse at a hospital I worked at was caught sodomizing male patients as they were recovering from surgery. A Canadian doctor hired a prostitute to come to his office and billed the public health insurance for treating her. As a pharmacist, I will sometimes call docs on drug interactions. The other day, the doc I talked to had never heard of the interaction I was calling on and said to tell the patient to take the meds. I guess since you haven't heard of it, it must not be a thing. The ego on some of these guys is insane. I'm currently a medicine student in Mexico. One of my professors told us that during his residency he worked in hospital on a fairly poor area. In these sorts of places birth control is a relatively unused practice, leading to poor families of 6+ children. In effort to stop this, they began to sterilize women during their children's birth regardless of their wishes. It's still a fairly common practice in the hospital. My grandfather was a physician in a small town and also worked as the pharmacist, as this was how it was done in rural areas. He lost his medical license for trading medication for sexual services from patients. He was a brilliant doctor and graduated top of his class from Dalhousie, but was a weirdo. When I was younger he was also arrested for smuggling drugs into Canada. Female colleague, cardiologist, grabbed a sedated man's penis while he was undergoing surgery. His penis was massive, and she grabbed it to show us. She also measured it. On a related note, her husband was a judge who had to resign due to a sexual harassment issue. Very strange couple. No kids. A lot cats, and they drive a Subaru. My mum's co-worker stitched his initials into a patient because he was so proud of his work. Veterinarian. I have worked with clients to hide abused dogs that were rescued from their mean owners until a shelter was located. I wasn't expecting this unethical act to be so well received. Thank you for all your kind words and for the gold. As long as I have a place to put an unwanted pet, I will continue to do what I can. Thank you to you all who have already adopted from a shelter or have taken in a stray. Even if you have paid a lot for your pet, as long as you love it and take good care of it, that's what we should strive for as humans. Not me, but my mom worked as a nurse in Brazil for a while and said that the doctors at her hospital would sleep during night shifts and it'd all be up to the nurses. They would get angry if they were awoken and wouldn't take the nurses seriously, which led to this one guy's death, despite my mom insisting that they check on him because he looked bad, because they didn't want to get up. Edit, by the way, this was in the 80s or so not sure if things have changed any by now. Med 4 student here. During one of my internal medicine clerkship in a small hospital, I get paged to a cardiorespiratory arrest in the cath lab. I arrive there, and a whole team is already working a way outdated ACLS protocol on a patient that was undergoing PTCA earlier. Apparently the interventional cardiologist has just placed a stent and was withdrawing when the patient had the arrest. After 40 to 45 minutes of resuscitation the patient did not pick up, so I was expecting them to just announce the time of death. That's when it gets unethical. The whole staff agreed to just send the patient to CCU, knowing he's dead, intubated on ambu bag, with a monitor showing a nurse's pulse and oximetry, and to tell the parents that the intervention was successful and that he needs observation before being discharged to regular floor. The patient was kept in the CCU and the staff would tell the family gradually that he was getting worse, and 2 hours later they told them that he just died because couldn't tolerate the procedure. All this to protect the cardiologist and so that he keeps a good reputation and record. After I asked around, they were apparently doing this for every arrest that would happen during catheterization in this hospital. I'm surprised there are no Dr. Harold Shipman responses yet. Admittedly, I've not read everything yet. The man wants so much unethical, but a prolific serial killer with 15 confirmed victims. But that number could be as high as 250 to 300 premature deaths caused by his care, not by incompetence, but genuine premeditated murder. The only British doctor found guilty of murdering his patients, and the fact that he got away with it for so long genuinely worries me, especially as you trust a doctor and his treatment of you with your life. My stepdad is a dentist, had a boss who was a fellow dentist that was doing fillings on teeth that did not have cavities to generate more money. My stepdad blew the whistle and started his own practice. My great-grandpa was a doctor and he used to say that he could guess the sex of a baby, but he'd write one thing on the chart and tell the parent another, so if he was wrong he could tell them they heard him wrong. I'm not a doctor, but I do work at a methadone clinic. I provide services. I had a client that was on 250 milligrams of methadone. and continued to use heroin and benzos regularly, like in the parking lot. He overdosed once in my office and another time in the lobby. We've called the ambulance on this man 4 times. He's been doing heroin for 28 years. We continued to up his dose and even phased him. He still tested positive for everything. I felt like it was unethical. I'm harm reduction based. But this was insane. It was like we were passing him candy at a parade. We had no idea if he was even taking the methadone. He was most likely selling. The fact that, after he overdosed in my office, yet we didn't encourage him into an inpatient facility, was the most unethical thing I've experienced. Harm reduction treatment doesn't work for everyone. My mother says that, while she was an intern at a hospital, a doctor didn't deliver a baby properly, and ended up breaking the baby's neck. And his supervisor tried to get my mother to take the blame, since she would only be reprimanded, while he would lose his license. She refused. Hardly unethical but weird. I was trying to get a diagnosis on discomfort in my balls. Doc didn't wear a glove when he made his inspection. Totally smelled his fingers when he thought I wasn't looking. When I was a young kid and first discovering the joys of Google, I thought it would be fun to search my surgeon father's name. One of the first results led me to a tabloid article about a nurse who was operating within his department, who kept killing off patients in some twisted angel of death perceived mercy killings. I was 9. My mom worked in a pediatrician's office as a receptionist. Their doctors had special codes for chart notes. Bob but ugly baby. They had more for things like noting the mom was an insufferable bitch. I don't remember specific abbreviations, but I can ask my mom later. This happened when I was a medical student working in the ER. This 20-something male was drunk driving and crashed his car into an elderly couple, causing them to require emergent surgery. He was belligerent and walking around naked in the trauma bay. Nurses were trying to get him to calm down and stay in his room and stop yelling. He was calling the nurses bitches and asking to go to the bathroom, so they gave him a urinal. As he was urinating, my attending went up to him and said, "I want you on that bed right now." He said, "Duck you," so my attending knocked the urinal out of his hand. Pies went flying all over the room. He picked him up and threw him on the bed and pushed some rock uranium through his fourth to paralyze him. Then he seemed to take his time with intubating him, letting his O2 sat get down into the 40s before finally letting him breathe again. I don't know what ended up happening to the guy in the long run. Turns out he had just broken up with his girlfriend and went on a drinking binge. He deserved to be punished for what he did, but I don't think he deserved to be forcibly intubated for no reason other than causing a scene. This was really a misunderstanding, but in college I thought I hadn't standard. That turned out to be a recurring case of a yeast infection I got from some fine young lady. The culture would come out negative for any standard, but the symptoms would return. The college doctor was a woman, and after my 3rd time to return to tell her the symptoms were back, even though the tests were negative and I had taken all the meds. She turned me away because she thought I had a weird fetish of her giving my Johnson a culture test. My stepdad slept with some of his patients. I have no idea what the context or number is, //. One of my ex-GFs was working at a mental health facility in Madison, and the patients there were like seriously mentally deficient. Obviously, some of the women were like full-bodied adults with 2-year-old brains basically, so this guy took advantage and didn't get caught until a patient got pregnant and they did a DNA test. Crazy. I know a urologist who gave himself a vasectomy. My mom is a nurse that worked at a hospice. She was known among the other nurses as having a gift. When it was coming time for a patient to reach his or her end, my mom would be able to guess the time of death usually within 5 to 10 minutes. The nurses would make betting pools and really were fascinated by what my mom could do. They would tip her off on a patient in bad condition and she would go in and take their temperature, feel the feet, and check their pulse, and walk out with an exact time. She won a lot of money and free lunches in her stay there. When a higher management official approached her one day about it, she immediately started to apologize for her unprofessionalism. The manager stopped her and told her she was in fact impressed by her ability. Please click subscribe if you enjoyed this video.